another episode of The Dispatch. I'm Amy Rose now with KDHE's Office of Communications, and I'm here today with Paula Clayton, and we're at the Healthy Kansans 2020 Planning Summit. So Paula, can you tell us what we're doing here today?
Sure, Amy, thank you. We are here with a broad group of stakeholders that are working on the next step of development of the Public Health Improvement Plan. We got to this day by a long process. One of the things that KDHE does is to develop the Healthy Kansans state health plan for our state. That is a process that started actually 4 years ago when staff throughout KDHE assessed data that was relevant to our state as it pertains to the Healthy People 2020 health objectives for the nation. Our state health agency, our state health officer, Dr. Mosier, brought together a steering committee that was comprised of medical providers, local and state public health experts, employers, elected officials, and a host of other partners throughout the state that have a vested interest in the health of our citizens to analyze that data and make some recommendations for the Healthy Kansans 2020 plan for our state.
Okay.
It started with we did a lot of work in terms of gathering input from citizens across the state through a survey monkey. So we worked, so we collected information on what people think are really the health problems that we need to work on. Where are the areas that we can make the most difference in improving the health of Kansans when we work together?
So you have a great group of partners here today, and what do you hope to glean from them? What do you want to learn from this process that'll help us move forward?
We're really looking for those activities that can address the elements of the Healthy Kansans 2020 framework that will have the biggest impact on improving the health of Kansans. We only have 6 more years before 2020, so we're really looking at those actionable items that folks from a number of disciplines and our partners across the state can work together on in addressing those challenges.
So today we heard from Julie Cox-Kain, who is the COO, Chief Operating Officer for the Oklahoma State Health Department, and she kind of talked through the process that they recently went through for accreditation and developing a state health improvement plan. What did you take away from that presentation that we could apply to what we're doing here today?
Yes. Well, Oklahoma has actually submitted their public health accreditation application, and we're one of the first 2 states that have been accredited in public health. So with the work that we're doing with the Healthy Kansans 2020 plan and developing the implementation part of that will serve as our public health improvement plan for Kansas. So I would very much expect that in 6 years we'll be having the same kind of a story with regard to how our public health improvement plan made a difference in the health and the lives of Kansans, similar to the very inspiring stories that Julie shared with us this morning.
Today we heard about the accreditation process that Oklahoma went through. Can you tell us what that process was like and what you learned from it?
Absolutely. It's a pretty rigorous process. And for us, it really signified making sure that we were an accountable organization for the health of the citizens of Oklahoma. It starts with strategic planning and health improvement planning, which is what you all are here doing today. And then it leads to just certain tests against standards that have been set nationally for public health departments and different groups or organizations representing the different parts of public health coming forward and meeting those standards through a process of document submission and also a site visit where they come and ask questions and look through the documentation. Well, one piece of advice I have is that I've been in public health for a long period of time, and I haven't found a public health intervention that can really be effectively implemented without partners. And so what's really impressive for me here today is that you have a room full of people who are interested in health. So continuing to collaborate and encourage community partners to come forward and share their experience, making sure that the implementation of your plan is really owned by the people of Kansas. I mean, health is so critically important to all of us, and this is really about the health of the community in which you live. So there's so much commonality in goal setting across all of these multitudes of sectors. So I think having it be representative of the people of Kansas and what they hope to achieve is critically important.
Well, I think one of the really most important parts of a process like this is really the partners that are involved. We have been so fortunate in our state to have actively engaged partners from all walks of life, from our partner organizations and agencies across the state that do have a vested interest in improving the health of Kansans and recognize the roles that they have to play. So we really appreciate everyone coming together. It's a really busy time, but this is really important work.
Yes. Well, thank you very much, Paula. And thank you, everyone, for the work that you do in public health. And we look forward to hearing about the input that we get today and where that's going to take us with our State Health Improvement Plan and Healthy Kansas 2020. So thank you again, and we'll see you on the next episode of The Dispatch.